Well, fall doesn't officially start until tomorrow, but doctors are already worried about the sickness that hits its peak in the winter.
Yeah, it's why the CDC is urging people to get their flu vaccine now. Jessica Borg live in the medical center with this health alert. Hey, Jess.
Good afternoon, guys. Yeah, doctors know, of course, that flu season is coming. They just don't know exactly when. Typically, it starts sometime in December, but it could be earlier than that. So the CDC is recommending that everybody get their flu shots now to make sure they're protected.
Because I have younger kids, so I just thought it would be best.
Passion Posey remembers last year's severe flu season.
It was kind of scary.
She says this year, everyone in her family is getting vaccinated. Dr. Michael Cheng says that's a good idea. He's a pediatric infectious disease specialist at Children's Memorial.
Everybody should get the flu vaccine if they haven't had some previous allergic reaction to the flu vaccine specifically.
The CDC recommends getting vaccinated early, ideally by the end of October, before the flu starts to spread.
It does take a couple of weeks for each person to develop kind of the full immune response to the vaccine.
Health officials say last flu season, more than 700,000 people were hospitalized with symptoms. That includes otherwise healthy individuals, as well as people most susceptible to getting sick, such as the elderly and very young. Dr. Cheng says one concern is that the flu can lead to dangerous, potentially fatal bacterial infections.
There seems to be an association with getting flu disease in your lung, which is where flu likes to go, and then having kind of an increased risk of getting a pneumonia from Staph aureus. Those patients can definitely have sepsis and have really severe infection.
You can still get the flu even if you've been vaccinated, but experts say it'll help.
And if you do get the flu, the flu is not going to be as bad as it was if you were not protected.
Now, flu season usually lasts until April. Last year it was May. Dr. Cheng says the nasal spray flu vaccine has been reformulated this year to protect against the most common strains. However, he still recommends getting the flu shot, which he believes likely offers the best protection. We are live this afternoon at the Med Center. Jessica Borg, KHOU 11 News.
At least you have some options this flu season. All right, thank you, Jess.